Hi, I'm Klars, and I've had chronic back issues for about 6 years now. Started out basically just over the course of a year and a half getting worse. So I ended up getting a endoscopic discectomy done 6 years ago on L5S1 on my left side, and then 3 years later ended up getting another microscopic or endoscopic discectomy on L4, L5 on the right side. And then just recently, about 2 or 3 months ago, I was playing volleyball and hurt my back. Got an MRI, turned out to be a disc extrusion again. Not quite the same as herniated disc, what I had before, but very similar. Went to several doctors, most of them surgeons, and they all recommended basically the same kind of thing. They said since the herniation was centered, that I should do a discectomy, microdiscectomy, and not even do an endoscopic one. They recommended microdiscectomy. I started doing physical therapy over the course of 10 weeks or so. Wasn't seeing any improvement, so I again looked for natural therapies and talked to a couple of people in that field, and they both recommended a similar approach. They said doing physical therapy, and you can do a stem cell injection. So I ended up going with the stem cell and PRP injection, and immediately after the shot, I would say there's no real change, but you definitely works like a super anti-inflammatory. So you go home and you definitely feel like all your inflammation is gone. But again, you still get the same symptoms, the straight leg raise and other things. Still having issues walking and bending over and doing things. But gradually over the course of the next 2 weeks, my symptoms pretty much every day would just kind of slowly improve. The amount of time I could sit would increase. I just started to feel better. And again, I'm kind of a big believer after going through the experience, because I was told about at the 10 to 12 weeks, if you're not seeing improvement, then your condition is most likely chronic and it won't just naturally improve. But here I was at the 12-week mark, got the shot, again started seeing improvements, and now I'm at the point where I can sit all day long. Again, there's still some pain with transitioning from going from sitting to standing, and discomfort when I start to walk, but goes away. And then now I'm able to walk, and I'm seeing a good improvement in my condition, and I'm hopeful that this is going to be able to heal completely.